Great. Hi, everyone. My name is Kara Green. I'm a family nurse practitioner and the director of clinical services at Hope Clinic, and I'm here with Ashe. Ashe, do you want to introduce yourself?
Yes. Hi, my name is Ashe Minix, and I'm the program management and outreach coordinator here with the Hope Clinic.
And we're here today to present our poster presentation called Bridging the Tuberculosis Education Gap in AA NHPI Communities. So we'll go through our slides. This is a presentation about our project with APCHO around TB education and materials for patients. I think Ashe is going to get us started, and I'll go ahead and move to the next slide here.
Yeah, so our learning objectives for this particular conversation are going to focus around the first thing is going to be culturally and linguistically appropriate education materials related to tuberculosis and latent TB infections for people in the AA and HPI community. So basically, one of the things we want people to take away from this is the importance of having culturally and linguistically appropriate education materials for folks in this community. The second thing that we want people to take away from this particular presentation from our project rather, is the importance of community partnerships and collaborating with local public health authorities for timely and successful treatment of TB and latent TB infection treatment. And so we really want people to understand the importance of partnerships, especially partnerships with your local public health authorities and other community agencies to make sure that people are getting timely treatment and successful treatment. And then finally, we want participants to learn about the importance of training not only new providers, but also more seasoned providers in culturally and linguistically appropriate and competent care for AA and HPI persons living with tuberculosis and latent TB infection. So basically, we want folks to understand that it's important to train, of course, new family providers, but also people who have been practicing for a while who may not have had this training previously. So that's one of the things that we want you guys also to take away from our learning objectives as well. Great. So a little bit about Hope Clinic and who we are. So just a brief history of Hope Clinic. We started in 2002 as a 4 hours a month volunteer only clinic. And from there, we grew and grew and grew and became professionally staffed in 2005. In 2008, we became a lookalike facility. So we were basically very similar to a federally qualified health center without the official FQHC designation. That didn't come until 2012. But we started out serving predominantly the Asian community in Southwest Houston in the Asiatown region. And then from there, we have grown to serve over 23,148 unique patients. We serve, who do we serve? So we serve the uninsured, the underinsured, and those with limited English proficiency. And we have lots of different services available for our patients. We have pediatrics, we have OB-GYN services, family medicine, optical services, dental services, and also behavioral health services. So from here, Kara's going to take it away and talk to you a little bit more about why we chose this project.
That's right. So I primarily see adult patients here in the clinic and the family side of things. And I think one thing that has really triggered our interest in tuberculosis as a federally qualified health center is just the burden of disease in our own community. So this really began to pique our attention, specifically when we would receive patients from our own refugee intake clinic here in town that's run by Harris County, which is a large county outside of that borders Houston and all around Houston. And we would see a number of patients coming in from referrals from that clinic with either positive TB blood tests or needing screening for tuberculosis. And what we know about TB in Texas and in Houston is fairly alarming. Texas is one of the areas that has a higher rate of tuberculosis and latent TB infection compared to other states. And unfortunately, we're seeing an increase in cases even as recent as 2019. So I had statistics that show that we're at a 2.8% increase in the state of Texas for TB, which is a concerning rate of increase for us, especially given everything that's going on around respiratory illnesses right now, the focus being on COVID, obviously, and importantly so. But for us, even over the last 7 years that I've been with Hope Clinic, TB infection has been a really important area for us to really work on, especially in the Houston area. So Houston is one of the largest metropolitan areas in Texas and across the nation, and our population continues to grow. And so as we look at this population growth and the statistics around tuberculosis, we really want to work on slowing the progress of tuberculosis disease, and specifically around treatment of latent TB infections in our community. We felt that we were poised in a place to address this issue too, because of the populations that we serve within our own local community here in the clinic and within our own neighborhood communities. So our background and our focus has been serving a broader Asian community, as well as our other populations of Spanish speakers and other individuals. But because of our network of community and the burden of disease for tuberculosis in the broadly Asian community in the US, we felt a specific burden around this disease in our subset of that population. I think we're always reminded, the CDC reminds us that in Asian populations, there's a 32% or 32 times higher rate of tuberculosis in the Asian populations. And so I think this is a huge call for us to do additional work in this area. In Texas, it's about a 20% higher rate for tuberculosis disease in Asian populations as well. So we feel really convinced about this issue locally and for our state. This particular project grew out of a project that we were approached by the City of Houston Health Department. We had worked with them in doing our reporting and a lot of our cases where we had additional questions. We had created some really important partnerships with the City of Houston around latent tuberculosis and TB disease. And so out of that, they approached us in 2017 to begin a partnership around treating latent TB infection in our clinic. So initially, we had a number of questions about how we would go about doing that and the logistics, the cost, how we would get patients into the clinic, all those kinds of things for actual treatment. But at the time, one of the initiatives of the City of Houston was to roll out additional private-public partnerships. And for us, even as an FQHC, they looked at our numbers around LTBI and positive TB screening and thought that we might be a good candidate. And there are a number of other clinics in town, including Texas Children's, that were carrying out similar projects with success. So as a part of that effort, they felt that we might be a good candidate for beginning LTBI 3HP treatment specifically here in our clinic. So back in 2017, it feels like just yesterday, but about 3 years ago, we started this process of developing an MOU, working around training for our providers and staff, and the basics of education around the 3HP regimen. And we started enrolling our first patients in DOT practices here in the clinic. And then since then, we've adopted a video DOT project with the City of Houston that's actually been very successful, especially in light of COVID and the difficulties around getting patients into the clinic. So I hope that gives just a little bit of background about our interest in the topic and how this particular mini grant project will hopefully benefit our populations and other populations across the US. I think one thing we learned as a part of this project that really prompted our interest to apply for the mini grant and take on this project was that we did still find that there is a need, a gap in terms of the materials that are available for patients and providers. And I know it's sort of hard to view on the screen, but I printed out some of the ones that the CDC has available and in Chinese and Vietnamese. And so I think there really are some great materials out there for patients right now, but what we've identified is for our populations and others, there's a lack of existing materials in languages and using pictorial type formats that would be helpful for patients. So we identified that need as a part of this project. Our project goals are threefold. So our first is to improve access to these materials, as I was just describing. So a number of our patient populations, like from Burmese people groups or Rohingya people groups, in some of those cultural groups, the literacy level of those individuals may be lower than those who in other groups where they are using more written and doing more reading. We've heard from our own patients when we've used other materials that they don't read or write. Some Burmese patients don't read or write in their own native language. And so we're hoping to really improve the cultural relevancy of the TB education materials for patients. So for example, the medication tracking page where patients are doing their DOT tracking, it's set out in a format that uses mostly word, descriptors for the days of the week, but we found that we need to use other diagrams and other prompters for some of our people groups, and we're hoping to do that as a part of this project. We also are hoping to strengthen our partnership. So the second part of this is that we continue to hear from some private doctors in our area and that serve our populations as well, that LTBI doesn't need to be treated. And I had a patient recently from Afghanistan that went to see another doctor and kind of goes back and forth between a few providers. And this patient told me that this other doctor told me that everybody has latent tuberculosis, so there's no reason to treat LTBI. So we see a real need in our community partners and other healthcare providers to provide education around latent TB and the importance of treatment and how it can prevent progression to tuberculosis disease for that specific patient and for our community and our nation and the world as a whole. So we're hoping to build additional bridges and really, and even in this virtual age, really do a lot of back and forth communication with other providers to connect them with the resources that we use as well. Our third project goal is to build capacity around healthcare providers that are very comfortable with having communication in culturally and linguistically appropriate ways to our age and NHPI communities and in ways that are really relevant. So we found even in surveying our own providers in the past, there still is a need for us to have a comfortability level around having these conversations and around comfortability around treatment. So our goal is to really build capacity both internally and then in the greater Houston area of private doctors and other FQHCs who are really comfortable in treating LTBI in patients. Next is our project goals and activities. So specifically, our goal is to design community education pieces and really build, and you'll see in the second project goal is to really build on what exists from the CDC and from Heartland and from the National TB Controllers Association and from other groups like APCHO around, take what exists and really build on that and translate into additional languages for use for our own population and then to share out to the broader community. Our third project activity and goal will be to have community education to at least 500 community members within these people groups. And we're planning to do that through channels like social media our own patient bases, and then numerous community partners that serve these community members within the greater Houston area. We're also hoping to provide education to our Hope Clinic practitioners, as I mentioned, and importantly to the next generation of providers that will be joining the workforce. So we currently have 20 family practice residents and 10 OB-GYN physician residents who are with us at our clinic sites. And so we have a really exciting opportunity to train the next generation in LTBI and TB disease practices that are evidence-based and up-to-date. We want to build in some tools within our electronic medical records that will make it super easy for providers to have the most up-to-date guidelines around TB education and have those tools right at the ready instead of even having to go out to up-to-date or the CDC website, which are really great resources. We want to build some tools internally so that the residents and our practitioners are really familiar with building, how to treat patients and use the EMR in a way that can support those activities. And lastly, we want to provide education to our community practitioners, as we've discussed, in collaboration with the City of Houston and with Harris County. And those TB divisions, we're hoping to provide specific materials and trainings, virtual meetings with those folks, and provide ongoing support around technical assistance to build the knowledge base around TB disease and LTBI. Shay, I don't know if you want to talk a little bit now about the project evaluation and how we're hoping to measure our work.
Yeah, so the ways that we're going to measure our work for the project evaluation, the first is going to be measuring by the number of pieces that are developed and translated. So we're going to evaluate this by looking at how many pieces of materials that we develop that are culturally and linguistically appropriate for the community, as well as the different languages, how many different languages we have those translated into. We'll be looking at different metrics for educating people within the community. So whether that's social media metrics, looking at how many folks we do patient consultations with, for example, and also looking at just the number of people through different channels that we choose to do for, excuse me, that we choose for the, for measuring how many people we actually come in contact with about this particular topic. So we'll also look at the number of providers that we educate as well, whether that's new providers, more seasoned providers. We're going to look at the total number of providers that we educate. And then we'll also be doing pre and post testing to determine the amount of change and knowledge and participation's understanding of TB and latent tuberculosis. So we'll have pre and post tests available as well as a way for us to evaluate, just to make sure that we are actually changing knowledge and not just giving people information, but making sure they're actually absorbing it and understanding it.
All right. Well, I know at this time, some of you may be watching recorded or the live version. We're happy to entertain questions. If you want to send us chats to Ashay and I, we'll be available for those things. We also are happy to schedule some one-on-one time with anyone who wants to talk a little bit more about the project or has some questions. And then also, we're interested in meeting anyone at the virtual exhibit table in the virtual lounge for those of you that want to participate in that way. So we just, Ashay and I and the whole Hope Clinic team, really thank you for listening about our project, and we're looking forward to the collaborations that this might bring with other organizations who are taking on similar or even other projects that might be a nice partnership for the work that we're hoping to undertake. Thank you so much for your time today.